Hello friends, today now we will discuss about the pneumococcal vaccine. Pneumococcal vaccine is usually given to a patient or normal individual to prevent the infection from the Streptococcus pneumoniae. Actually the severe infection from the Streptococcus pneumoniae. The normally severe infection caused by the Streptococcus pneumoniae are normally that is pneumonia, bacteremia and meningitis. These are the three severe forms of the streptococcal pneumonia infection. There are other as well. So normally if you want to understand this, there are 80 serotypes. 80 serotypes of streptococcus pneumoniae is surround to us, is in the environment, is in the surrounding, and is in this world. That has been till we have came to know. There may be a more, but till now we have came to know that 80 serotypes are around us. Among that, we have made a vaccine. There are two types of vaccine. One is the pneumococcal conjugate vaccine, that is PCV13, and pneumococcal polysaccharide vaccine, which is known as the PPSB23. Actually, 13 and 23 indicates the number of serotype that has been included in that vaccine. Means that the vaccine has been made and the serotypes has been included in that. In pneumococcal conjugate vaccine, there are 13 serotypes. Means if you get this vaccine, you will have immunity against this 13 serotype only. Okay. If you are getting this pneumococcal polysaccharide vaccine, then it will have the immunity against 23 serotypes only. Okay. So if you see that there is 23 and 13 only, so you will say that this is the better. The 23 it will cover more serotype, you will have immunity against the more serotype, then this is the better one. Actually it is partially correct, because you have to understand, for understanding this you need to understand the basic immunology. Normally our immune system has two parts. Means there are two types of antigen presentation. One is thymus dependent, one is thymus independent. Okay, thymus dependent is the thing that occurs to any antigen, any foreign body, any bacteria, anything that comes to our body, and that is if protein in nature, then that will be processed through the T cell pathway. So you are saying that any protein in nature has come, that will go to the antigen presenting cell, that will bring to the T cell, and the T cell will then process it. It will release the interleukin 2 to increase its clonal expansion. Then there will be interleukin 4, 5, 6 that will help to differentiation of the T cell and goes signal to the B cell, convert the B cell into the plasma cell. By this way they are going to produce the antibody. But the additional thing is that there is production of memory shell through this protein nature T cell pathway, thymus dependent pathway. Whereas in case of the polysaccharide, other than the protein, that may be polysaccharide, that may be fat, that may be carbohydrate, so that component doesn't go through the T cell pathway. That will not be picked up by the antigen presenting cell. And if that is not pick up at that MHC2, mainly you are saying that protein nature. Okay, so this carbohydrate and fat will be processed by B cell directly. Now B cell will produce antibody, there will be the production of antibody, but difference is only that B cell pathway will not have the memory shell. Now what is the difference then? The difference is that once you have gone through this conjugate vaccine, you have the memory shell. Whenever there is any component, any serotypes will infect you, it goes inside the body, then the body has the memory shell. It will directly produce the immunity. They will reboost immunity and protect you from getting the disease. That is more important. Or either if you have got the disease, then it will have the less severe form. The difference mainly is memory shell. Memory shell will help you to the long life and also help to produce the reboosted immunity. That is important thing. Whereas if you are giving polysaccharide vaccine, there will be the immunity inside your body, antibody will be produced, there will be the antibody inside your body, but that antibody doesn't have memory. It will last for 3-5 years and then that vaccine coverage is over. But when you are getting pneumococcal conjugate vaccine, it will have a longer protection. That is the main concept. Okay. There is one more concept of giving this vaccination, how to give and to whom it should be given. Normally, the pneumococcal conjugate vaccine is usually given to the children. Why we are giving to the children? Obviously, children, elderly are more prone to have this pneumococcal infection and other coexisting diseases as well. We'll discuss later. But the thing is that the infant children, they are more prone to get this pneumococcal infection. Now, this conjugate vaccine will be given to the infant and children. Why? Because this is protein in nature, there will be production of the immunity, there will be production of the antibody as well as the memorization. That is important. Okay. And pneumococcal polysaccharide vaccine is not usually given to the children and infant. Why? Because you will give this vaccine, he or she, the children will have the antibody for certain period of time, but then after that it will go away. So the concept was initially that you give the conjugate vaccine to the children and this polysaccharide, pneumococcal polysaccharide vaccine to the elderly people. That was the concept. It was given to the elderly people because at the 60 years or 70 decade of your life, 6th or 7th decade of your life, your immunity has totally come down. That had been reduced. Now you don't have your immunity is totally dependent upon the antibody, the natural infection that has been occurred in your whole life. That is the main basis of your immunity. So now you can have, if you don't have the immunity against the pneumococcus, then let's just give the more coverage so that if any serotypes comes, if it includes in this serotype, then he or she will not get infected. If other than also this serotype also you have the infection, then disease will be less severe. There is also one more concept for this pneumococcal conjugate vaccine that will give a less serotype, and in the long term of life, he or she will be encountered the Streptococcus pneumoniae antigen of these different serotypes, but will not develop the severe disease or even not develop the disease. If developed, then it will have the natural immunity. Because of that, it was mainly given to the children and this is given to the adult. Now, with this concept, concept has been changed later, and the new concept has been arrived of giving the sequential vaccine. That is one vaccination after another. Both can be given. The only point is you have to know about the main thing about the sequential vaccine is the duration. When should be given and what should be the gap. That is important thing about the sequential vaccine. Okay, so we'll discuss about the sequential vaccine, how it is occurred and when it should be given, and that will be an important point as well. Okay, so now comes to the other condition where this vaccination can be given. Okay, normally you see the immunocompetent person. A person is healthy, purely healthy, but he is having this his immunity is competent, healthy also as well, but he is having this chronic disease of the heart, chronic disease of the lung, chronic disease of the liver, he is having diabetes, he is alcoholic, having a cigarette smoker, then these are the potential candidates to have the streptococcal pneumonia infection. So to prevent the infection, we'll give vaccine. Vaccine is to prevent the infection. So we'll give the vaccination. In this age group, age above the 65, if he or she presented to you without any vaccination, just directly go with the sequential vaccine. You are now going to give him sequential vaccine. Then there is single vaccination has been went up. That concept has gone. Now you have to give the sequential vaccine for better protection, better immunity. Okay. So this sequential vaccine, now what will you start? You will start with the pneumococcal conjugate vaccine. A person came, he is in the elderly, he is in 60, 70, he comes to you, you have this chronic heart disease, lung disease, liver disease, diabetes, alcoholic, cigarette smoking. Any person you go and find out, most of the people are at this age have any one of this condition. So what to do in this situation? You will directly go with the pneumococcal conjugate vaccine. Give him step. Now sequential vaccine, we have to give the next one. The next one should be, if you have given already, he has not taken any vaccination till date, you have given this conjugate vaccine. This is protein in nature, it will produce the immunity as well as the memory share. Now after 8 weeks only, after 8 weeks, you should give the pneumococcal polysaccharide vaccine. What is the timeline? Nothing has taken, you given the pneumococcal conjugate vaccine, PCV 13, okay. Then after that, what you will do? You will call him at 8 weeks after or at 1 year. Usual guideline was initially made to give one vaccine, pneumococcal conjugate vaccine, start, and after 1 year of pneumococcal conjugate vaccine, you give the pneumococcal polysaccharide vaccine. This was the concept, but you can give this as a start dose, and after the second booster or sequential, which should be given this at greater than 8 weeks or at 1 year. It's up to you what you choose. Give at greater than 8 weeks or at 1 year. So you understood that immunocompetent patient, this chronic diseases come with this, you have given the vaccination. Now, if somebody come to you that have already taken this vaccine, pneumococcal polysaccharide vaccine, now you have to think about it. Okay, somebody came to you, he is saying that, Dr. I am at risk of infection, or he is having this chronic lung COPD, asthma, and repetitive, his COPDs get exacerbated due to infection. Then you are thinking, okay, I have to give this vaccination. Then you will ask, what is your vaccination status? He will say, okay, I have taken this pneumococcal polysaccharide vaccine 2 days ago, 1 month ago, 2, 3 months ago. Then you have to understand that if somebody has taken this pneumococcal polysaccharide vaccine, you cannot give this pneumococcal vaccine before 1 year. This is a group with this condition already taken pneumococcal polysaccharide vaccine. The conjugate vaccine cannot be given until 1 year. There must be a 1 year gap. In the previous one, when you give, he or she has taken this, you can give at 1 year or at 8 weeks. That depends upon you. But when this has already taken, you cannot give this pneumococcal conjugate vaccine unless 1 year. If you think, okay, he has taken the pneumococcal polysaccharide vaccine, I'll again give the polysaccharide vaccine, you can give, but the gap should be 5 years. So, if somebody comes, he has a polysaccharide vaccine taken, you cannot give the same polysaccharide vaccine 23 again unless 5 year gap. So there is no point of giving this, the patient follow-up will be there. So you think, okay, you call him whatever the date he has given, make 1 year gap and give the pneumococcal conjugate vaccine. This is sequential vaccine. I hope you have understood. The same scenario applies for this is a group. There are the other more potential risks of having streptococcal infection. The group of people are, even if he or she is immunocompetent, but if there is a CSF leak or a cochlear implant, in that case there is a severe chance of having streptococcal pneumonia to meningitis. So you have to consider to give this vaccination as soon as you diagnose this case. You will start the sequential vaccination. A person having functional or anatomical asplenia means he or she has congenital disease like sickle cell disease and other hemoglobinopathy. This is functional asplenia, or he or she may have undergone splenectomy or is congenitally absent. Then this congenital or acquired asplenia. So in this condition, he or she is more risk of getting streptococcal infection. You know that streptococcal pneumonia is this is the capsulated organism, okay, and the capsulated organism are usually cleared in our blood. The blood stream pathogen are usually cleared by the spleen. If you are anything in the blood, and that has to be cleared, that has to deal with the spleen. Spleen has the right decision and has the duty to deal with it. If the spleen is not there, now streptococcal infection, mainly capsulated organism infection, will be occur more and more in a asplenic patient or splenectomic patient. So we give the vaccination against all these bacteria that have the capsule, like meningococcus, this Haemophilus influenzae type B, and Streptococcus pneumoniae. These three vaccinations must be given to the asplenic patient. Okay. Then immunocompromised patient. The patient is already has come, immunity has been shut down, immunity is compromised. like HIV. If there is any congenital or immunodeficiency syndrome in the case of children, chronic renal failure is also immunocompromised patient. You have to consider nephrotic syndrome, immunocompromised patient. Any cancer, leukemia, lymphoma, multiple myeloma, Hodgkin lymphoma, any cancer, they are immunocompromised patient. Solid organ transplant. Now, recently we are saying that there are transplant happening increasing in the country. So, solid organ transplant patients need to get vaccinated, because we will, after transplant, give the immunosuppression and decrease the immunity. At that time, there will be a more and more chance to get this capsulated organisms to go in immune infection. And any form of the heterogenic immunosuppression, which includes the transplant, as well as any patient that is getting steroids for a long period of time, say 2 weeks, more than that, 21 days actually, or any other immunosuppression drug for any reason. There are a lot of conditions that immunosuppression drugs are going on for a lot of conditions. Even you can consider this steroid for a long time can cause a long, not much, even 2 to 3 weeks, they will have the immunosuppression. So in that patient also you need to do the vaccine. Now the difference is, when we came about the age group, we have talked about that in this age group we'll give this pneumococcal conjugate vaccine, and after 8 weeks or 1 year we'll give this pneumococcal polysaccharide vaccine. The same applies for all this group. You give pneumococcal conjugate vaccine, after 8 weeks you can give pneumococcal polysaccharide vaccine. No tension, you give it. Any age group, if it comes into the 24 to 71 month, you give this pneumococcal conjugate vaccine. 6 to 18 years, give pneumococcal conjugate vaccine. 19 to 64 years, give pneumococcal conjugate vaccine. Greater than 65 years, need give pneumococcal conjugate vaccine. No problem. Give second vaccine is pneumococcal polysaccharide vaccine. You can give. These are, now you cannot wait for 1 year. Okay, you have to give this after pneumococcal conjugate vaccine. This pneumococcal polysaccharide vaccine should be given at 8 weeks, because these all are the people of having potential risks of having infection. So only 13 serotype cover will be not enough for them. If the other 10 serotypes present in this will have the infection, then there will be a more. There is no point of vaccination which is only this. There is always better you give. Always better you have to give. That is the point. You give pneumococcal conjugate vaccine, after 8 weeks you give this pneumococcal polysaccharide vaccine to all these age groups. Only condition will come as previous. If he or she has taken this pneumococcal polysaccharide vaccine by any age group, then what was the initial concept? If polysaccharide vaccine is given, then there should be 5-year gaps for the next polysaccharide capsule and 1 year minimum gap for this pneumococcal conjugate vaccine. And that will apply to these people also of age group 19 years to above. But if he or she is below 18 years, 6 to 18 years or 24 months to 17 months, this group of people, we will not maintain the 1 year gap. We will maintain the 8 weeks only. So if we have given the polysaccharide vaccine also, the next vaccine, if we have to give, initially we have to maintain 1 year gap for this age group of people and this to this age group of people, but in this age group of people, we will give in 8 weeks. Hope these are not being confusing to you. If you are not getting confused, forget about everything. No vaccination has been taken, give conjugate pneumococcal vaccine. Wait for 8 weeks, give this pneumococcal polysaccharide vaccine. That will be the most of the case scenario to you, and follow that. If otherwise somebody comes with the pneumococcal polysaccharide vaccine, okay, and he is saying as he has taken already, now you have to think about that what next will be do. Normally the minimum gap for giving this polysaccharide after polysaccharide conjugate is 1 year, and again if you want to give polysaccharide only, then there will be 5-year gap. This should be maintained. Follow this. There is only exception this initial age group and this high risk potential where we give in 8 weeks only. But you don't have to remember that. You just remember the initial concept and that will be fine. Okay, that is all about pneumococcal vaccine. If you want to know more about the influenza, it becomes serious all the time, and that is also a respiratory tract infection. Influenza vaccine is nothing. We usually give every year during the October and November period before the onset of this flu season, the influenza season, and it has usually combination of 2-3 strain that gives recent strains that give a protection against us, and it should be taken every year. That is the point. If you or he is in the endemic zone, suppose there is an outbreak of influenza, and if you are there, you are a medical doctor, you are anybody, you are there. So you should, what you will do? There are two options. Look, when you should get vaccinated. That is for sure. You get vaccinated, but the vaccine will take time, minimum 2 to 3 weeks to get your immunity. Till then, you can cover yourself, you can protect yourself. You take the prophylaxis of oseltamivir, that is known as the Tamiflu. Okay, and this is the trade name, I think, Tamiflu, which we get in the market. So it is 75 milligram OD is the prophylaxis. When you go to the treatment, we will give 75 milligram BD for 5 days. This is a treatment, and for longer, if he or she is more sick, then you consider little more. Okay. Oseltamivir, name in the Tamiflu, its name in the market. I'm not going to publicize any company, but just saying that it is only in my mind, so I'm talking about it. Oseltamivir, 75 mg, BD, any influenza patient, he or she has diagnosed, you give BD, treat for 5 days. But if you are in the outbreak condition, you have taken the vaccine, now what you will do? You will take the oseltamivir, but that will be only OD dose, 75 mg OD, that is a prophylaxis that prevent you from getting infection. Okay, and how long you will take? Usually you should take 2 weeks. You get vaccination, you take prophylaxis for 2 weeks. Otherwise, what you can do is, you can see if there are the last influenza case in that region that surround you was, when was it is. After that, 1 week you should take. So last influenza case, then 1 week more prophylaxis, or either you take a vaccination and 2 weeks of oseltamivir. That will be the prophylaxis. Hope this will be helpful to you when you get in that situation.